Hi, this is Abhijit. This is the first video of my channel. Today we will be covering three topics, three articles in all total, and a drug which has been recently approved by the Indian Drug Council. Now, the first topic which I shall discuss with you guys is the association between the thyroid hormone levels and Apache 2 score in critically ill patients. This article was published in the Journal of Anesthesia, Pain and Intensive Care by Rio et al., who studied the correlation between the free thyroid hormones and Apache 2 score. Now, for this study, the at admission, the free T3 level, T4 level, and TSH level and Apache 2 scores were recorded in critically ill patients admitted in the ICU, and the comparison was made between the survivors and the non-survivors. Now, it was found that although there was no significant difference between the thyroid hormone levels in the survivors and non-survivors, but a lower free T3 level and a high Apache 2 score at the admission criteria were found to be more indicative of a bad or ill outcome. That is, the non-surviving group had a lower free T3 level and a higher Apache 2 score at the time of admission. The second topic is about comparison between apixaban and aspirin in patients with subclinical atrial fibrillation, and the study from which the conclusion is withdrawn is the Artesia trial. Now, what is Artesia trial? Artesia trial largely determined the efficacy of treating subclinical atrial fibrillation and compared apixaban and aspirin. Now, it has been seen in the Artesia trial that 25% of the patients in the Artesia trial had a CHADS2-VASc2 score of greater than 4 and a stroke and systemic embolism rate of 2.2% per year. In these patients, treatment with apixaban has greater benefits than the risk. That is, the benefits outweigh the risks. Now, conversely, in patients with CHADS2-VASc score less than 4, the risks outweigh the benefits, and in this group of patients, treatment with apixaban is not recommended. For patients with CHADS2-VASc score of equal to 4, the patient preferences will determine treatment decisions. The next article is in the dermatology sector, and it is about an article published in the Journal of Skin Research and Technology by Lan Zhu et al. Now, chronic idiopathic urticaria is a very irritating disease, and although it is treated mostly by first line and second line drugs, the third line drug omalizumab, its optimum dose remains highly controversial, and till date no proper article stating the optimum dose of omalizumab in treatment of chronic idiopathic urticaria has been discussed. Now, this study tested three doses of omalizumab: 150 milligram, 300 milligram, and 600 milligram of omalizumab in patients with established chronic idiopathic urticaria. Now, the indices employed for the assessment of treatment efficacy were the weekly itch severity score, weekly hive severity score, weekly urticaria severity score, dermatology quality of life index, and adverse reactions. It was found that 300 milligram of omalizumab is the optimum dose to treat chronic idiopathic urticaria, although 150 milligram of omalizumab also produced significantly good results. The next topic to discuss is the drug of the week, which is plazomicin, which has been recently approved by the Board of Drug Control for the treatment of complicated urinary tract infections in patients above 18 years of age. It is mainly indicated for treatment of complicated urinary tract infections and pyelonephritis, especially caused by the organisms E. coli, Klebsiella pneumoniae, Proteus mirabilis, and Enterobacter cloacae. Its dosage is 15 milligrams per kg every 24 hours, and it is to be given as a slow infusion over 30 minutes. That's all for this week. Thank you very much for listening through this video. Please subscribe to my channel to encourage me so that I can come up with this more type of this content in the future. Thank you very much.